Hello.
Hi, my name's Crystal. I'm going to be the nurse practitioner caring for you today. Today I'd like to start with a reflex exam. I'm doing hand hygiene for my safety and yours, okay?
Okay.
So I'm going to start by assessing your bicep tendon reflex. Okay, what I need you to do is relax your arms down. And I am lightly going to tap. Perfect. We'll do that one more time. Excellent.
Okay.
We're going to come to this side now. We're going to repeat that again. Palpating that brachial. Thank you so much. Excellent. All right. Now I'm going to do your tricep reflex. I'm going to ask you to lift your arm up behind you and allow me to support the weight.
Okay.
Okay. If you can straighten your arm out for me. And back in. Excellent. One more time. Excellent. We're going to do it on this side. And allow me to support the weight of your arm. Excellent. All right. I'm going to come back around and do your brachial radialis reflex. This is going to be in your wrist. I'd like you to just relax your wrist down for me.
Okay.
Excellent. I'm going to be feeling for that foaming process. More time. Very good. Relax that arm down. Very good. All right. Next, I'm going to be moving to your knee reflex, okay? So I'm going to come down, ask you to straighten that knee just a little for me, and back in. Very good. Perfect. One more time. All right, you've got some strong knee reflexes. Here we go. I'm going to do that one more time. Very good. All right, now I'm going to be moving to your ankle tendon. Okay, I'm going to support your foot, palpating back for that Achilles tendon, and I'm looking for a downward. Relax that for me. Very good. Come to the side. Thank you. Very good. All right, and that is, there's one more. And I'm going to use the blunt end of my reflex hammer here. And I need to test the bottom of your foot, your plantar reflex, okay?
I'm very ticklish.
I know you're very ticklish, and I'll do my best to stabilize your foot, okay? Perfect. Very nice. Okay, and that will conclude our assessment of reflexes. Okay, I'm going to be moving next to your cranial nerves. And I'm going to do hand hygiene again before we start that. All right. So the first thing I'm going to be testing is your olfactory nerve. This is your ability to smell. Okay, so I'd like you to go ahead and close your eyes for me. I am going to block one nostril. Tell me what you smell.
Alcohol.
Okay, and the other.
Yeah, same thing.
Okay, I'm sorry, I knew that would be a strong smell. All right. Next thing I'd like you to do is I'd like you to put your glasses on for me. And I'd like you to cover your right eye. Cover it with your hand. And I'd like you to hold this about 14 inches from your face and read the smallest line that you are able to read.
In the 2nd century of the Christian era, the Empire of Rome comprehended the fairest part of the earth and the most civilized portion of mankind.
Perfect, you can stop there. Go ahead and cover your left eye and attempt to read that again.
In the 2nd century of the Christian era, the Empire of Rome comprehended the something part of the earth and the most civilized portion of mankind. The frontiers of that extension, some modern day, were grounded by ancient renown and disciplined valor.
Perfect. And that was the smallest text
Yeah,
available, so
it's
there's
small.
nothing to go down to.
It was borderline, but I could just barely read it.
Sure. All right, we're gonna move to the oculomotor. I'm going to dim the lights for this. Ask you to take off your glasses. And I'm gonna be shining a light into one pupil, then the other, and then I'm gonna swing back to the first and make sure that your other eye is constricting at the same time, okay?
Okay.
Here. Excellent. So the eyes were reactive to light there. Next, what I'd like you to do is look at the tip of my light, and then I'd like you to look at the pink dot behind you, okay? So go quickly from me, pink dot, me, pink dot, me, pink dot. Perfect. And we were reactive to accommodation as well. All right. Next, I'm going to be testing your trochlear nerve. And to do this, I'm going to be using my pen light. I'm going to ask you to follow it in several different directions. So wherever it goes, I want you to follow it with your eyes with your head straight. Okay. Perfect. All right. I'm going to be moving to the trigeminal. So with this, I'm going to be bringing this very close to your eye and seeing if your eyes blink when it is touched, okay? Okay. Perfect. All right. The next thing I'm going to do, I'm going to ask you to close your eyes. And I'm going to run a soft item across your forehead. Please tell me if you feel this.
Yes. Yes. Yes.
Perfect. And you can go ahead and open those eyes. All right, I'm going to test your deeper sensation. I'm going to be alternating between a sharper end and a softer end, okay? This is sharp, and this is, this is sharp, and this is soft. Okay, I'm going to be doing that in your face. Go ahead and close your eyes. Okay. Tell me if it's sharp.
Sharp. Sharp. Soft. 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 Sharp. Sharp. Soft.
Okay, very good. Next, I'm going to be holding something warm and something cool against your face. I want you to tell me if it is warm or cool that you feel.
Okay. Eyes open or closed?
Eyes closed, please. This is going to be cold,
Okay.
and this is going to be warm.
Okay. Warm. No, cold. Yes. Cold. Warm. Warm. Cold. Warm.
Very good. All right, and we have already tested the abducens nerve by asking the patient to follow the pen light in the 6 cardinal directions. That was cranial nerve number 6. Going to cranial nerve number 7, I'm going to ask you to do a few different things, okay? First thing I'm going to ask you is to show me your teeth. Perfect. Smile for me. Good. Raise your eyebrows. Brim with your eyebrows. Excellent. Puff out your cheeks. Good. I want you to close your eyes tightly and don't let me open them. Excellent. I want you to tense your neck muscles up. Excellent. All right. So that was testing cranial nerve number 7. We're going to go to cranial nerve number 8, the vestibule vestibulocochlear. All right, so for this, I'm going to occlude one ear, and I'm going to whisper 3 letters and 3 numbers. I want you to tell me what I have said.
Okay.
So occluding one ear.
A, B, C, 1, 2, 3. D, E, F, 4, 5, 6.
Perfect. All right. Now I'm going to do a Weber and Rhine test on you. So for the Weber, I'm going to strike, and I'm going to place this on top of your head. I want you to tell me if you hear it evenly in both ears or differently, more or less in one.
Okay. I think it's pretty even.
Now, for the Rhine test, I'm going to strike again. I'm going to place back here on your bone. Okay, once you can no longer hear it, please let me know, and I'll move it to the front and see if you can hear it then.
Okay. Okay, I can. Yes, I can still hear it.
Come to this side.
No. Yes, I hear that.
All right. For your glossopharyngeal nerve, I'm going to ask you to say ah and stick your tongue out. Perfect. Say ah again. Excellent. Now, the part, I'm sorry, it's probably not going to be very comfortable. I do have to elicit a gag response on you. Okay. I'm sorry, stick out that tongue. I'm so sorry. I'm so sorry. And I'd like you to swallow for me. Excellent. And I do not determine any, do not sense any hoarseness in the patient's voice. All right. For this next one, I'd like you to shrug your shoulders up against me. Good. Turn your head into my hand and against me, and my hand against me. Excellent. And this very last one, your hypoglossal, I'd like you to stick your tongue straight out to the right and to the left. Excellent. Very good. So that is going to conclude our cranial nerve assessment. Okay, we're going to move on to the sensory exam. Okay, so again, I'm going to be using our sharp and soft. Okay, so tell me, I'm going to start on your arms. I'm going to go to different points in your body, and I'd like you to tell me if you feel sharp or soft.
Okay, close my eyes.
You can close your eyes.
Sharp. That's soft. Sharp. Soft. Soft. Sharp. 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 Soft. Sharp. Sharp. Soft.
Excellent. All right, we're going to go back to that warm and cold. So this is just going to be assessing your ability to feel temperature. Okay, go ahead and close those eyes for me.
Cold. Warm. Warm. Cold. Cold. Warm. Cold. Warm.
Excellent. All right, next I'm going to use my tuning fork, but I'm going to ask you to hold your hands out for me, and I'd like you to tell me, I'm actually going to flip your hand over here. I'd like you to tell me what you feel, okay? When you feel vibration and when you feel it stop, okay?
Okay.
You feeling that
Yeah, I
vibration?
still feel it.
Okay.
I still feel it. Now it's stopped.
Great, we're going to do that on the other side.
Yeah, feel it. and stop.
Perfect. With your permission, I'd like to take your socks off to do the same assessment on your toes.
Okay. And stop. Feel it? And stop.
All right. Next, I'd like you to close your eyes. I'm going to move your big toes in directions up and down. When I move them, tell me which direction I'm moving them in. Okay?
Okay.
Close your eyes.
Up, up, down, up, up, down, up, down.
Excellent. All right. And I am going to next I'm going to run just a soft cotton swab over. Tell me when you feel this, okay? Go ahead and close those eyes.
Okay. Yes. 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 Yes.
Excellent. All right. So now I'm going to begin with your upper extremities, okay? And if I may hold your hand, put that over for me. We're going to do the same thing that we did with your toe down there. When I move it up, I want you to say up, down, I want you to say down. Okay?
Okay.
Here we go.
Up, down, up, down,
Keep those eyes closed.
up, down, up, up.
Perfect. All right. Now next, I'm going to test your discriminative sensation, okay? So I'm going to place something in your hand. I want you with your eyes closed to try and tell me what that is, okay?
Okay.
Go ahead and close your hand around that.
Feels like a coin.
All right. And keeping those eyes closed, I'm going to place something in this hand now.
Yeah, it's another coin.
Okay, is it the same?
This one feels a little bit smaller than the other one did.
Excellent. All right. Next, I am going to ask you to keep those eyes closed. I'm going to draw a number in your hand. I want you to tell me what this number is.
A 9. Maybe a 9 again.
Okay, very good. And on this hand,
Not sure what that was. Oh, an 8. An 8.
okay, very good. All right. Now for this one, I'm going to be using my little pin here, okay? I want you to tell me if you feel 2 points touching you or 1, okay?
Okay.
Go ahead and close those eyes. And I'd like your hand turned up. Very good. 2 points or 1?
2. 2. 2. 1.
Okay.
2. 2. 1. 1.
Very good. All right. I'm going to ask you to close your eyes. I'm going to touch you at various places on your abdomen, your arms, and your legs. Once I have touched that location, I'd like you to open your eyes and point to where I touched.
Okay.
Excellent. And now I'm going to test double. Okay, so I want you to make sure that you are feeling this on one side or both sides, okay?
Okay.
Tell me one or both.
Both.
One side, but two pokes.
Okay, one side, two pokes, very good.
Two pokes on one side. One on each side.
All right, very good. And that will complete our assessment for this part. Thank you so much.
All right, thank you.